Okay guys, I'm at the gas station. We're gonna talk about ACE and ARBs. ACE and ARBs, what do they have in common? A is for angioedema. Okay, angioedema. ACEs and ARBs, not as common in ARBs, but it is still a significant adverse effect. Why is it an adverse effect and not a side effect? Because anaphylaxis. You run the risk of your patient suffocating to death because their face, their lips, their throat is swelling up. Angioedema is a severe side effect. Patient teaching: if your patient shows signs of swelling in the face, in the lips, they want to contact the answer will be, oh, contact a healthcare provider immediately. You need to go to the hospital. Go to the hospital. For ACE, you're gonna have a persistent cough. Nothing you do will get rid of this cough. This is an adverse or a side effect. It won't kill you, but you're gonna have a persistent cough. So what providers will do, if you're having that dry persistent cough with an ACE inhibitor, they're gonna switch you over to an ARB because an ARB does not have that effect. And then they both are gonna elevate your potassium levels. So you know that your ACEs and your ARBs are gonna elevate your potassium levels. What does that mean? What are the possible drug interactions? You don't want to give this drug with a potassium sparing diuretic because now you're gonna have too much potassium in the body. Too much potassium in the body. So, okay, those are our most... You don't want to give ACEs and ARBs to women who are pregnant. It's contraindicated. It causes fetal harm. Okay? So who are we giving these drugs to? You're not giving them to African Americans, quote unquote. Their renin count is low. It's not going to work for them. You need to either pair it with a diuretic or give them a different drug. These drugs only lower BP. They don't affect heart rate. They do not affect heart rate. So you don't need to check heart rate. You need to check BP. ACEs and ARBs are pretty straightforward. Like, don't give it to pregnant women. Watch for angioedema. Watch for elevated potassium levels. And you want to switch from an ACE to an ARB if your patient has that cough that they just can't get rid of. And yeah, it's pretty straightforward. Beta blockers next.